I'm not opposed to that. So, so I walk around. I don't like standing behind a podium, so bear with me as I do this. When Nancy approached me on this topic about a year ago, we decided to do it in November because it is National Family Caregivers Month, and it is we need to honor our caregivers, and we don't do that as often as we should. And so, we commend you for everything that you do because you're making this world go around right now. We shouldn't be giving you a month. We should be recognizing you guys every single day of the year. So thank you for what you do. I usually like to give myself or point out a little bit of something about myself before I give this presentation. Caregiving is a little bit of a passionate subject for me. And it is, my mother was diagnosed with multiple sclerosis when I was 9 years old. And so I know what it's like to be a caregiver. I do not know what it's like to be in your situations, but I have been there doing bathing, dressing, getting up multiple times in the middle of the night for nights on end. I know, what it's like to have to place your loved one in a nursing home and then watch them, be there for many years and then pass away with the help of hospice care. And so I've been through the full spectrum, and I've done long distance caregiving. I have, I don't talk about this just from a professional level as a social worker, but I talk about it from a personal level as well. I have been there. I have burned out multiple times throughout my career and my course of doing caregiving for my mother. And so I speak about this from a very personal standpoint. And so just, I want to put that out there because I think sometimes people think, well, what does this lady know about getting up in the middle of the night? I know what it's like, and I know what that sleep deprivation is. So kind of keep that in mind as I do this talk and just ask questions and fire away at me. So on that note, we're going to define what a caregiver is initially. And a caregiver is somebody who assists another person with activities of daily living, so like bathing, dressing, feeding, meal prep, and or medical issues. This can be a spouse, a child, an extended family member, a friend. It can be anyone of any age. So I know of people, youth as young as 8, 9 years old, up to people in their 80s doing caregiving. So it runs the full gamut of age. So it doesn't necessarily mean just because you're young or you're old that you're involved in this. It's all ages. There are approximately 43.5 unpaid caregivers in the United States that have been caring for an adult or child within a 12-month period of time. That's only a 12-month period of time. That's not accounting prior to that. That's a huge number of caregivers that we're looking at. Unpaid caregivers account for 80% of all cares that are provided within the home setting. That means only 20% are getting hired in and brought in from the outside. If we assign a dollar value to that, and I like the statistics because I think it gives an idea of what is really out there. If we assign a dollar value to that in the year of 2013, it was $470 billion that unpaid caregivers would have been paid if they were getting a salary. That is more money than what was being paid in paid caregiving and also through Medicaid personal care. So that's a huge amount of money that you guys are doing. Yes?
Where did that number come from?
That is from the agent or the area agents or AARP statistics that they do. Yeah. So they somehow assign dollar values to it, and I'm guessing It's based on the number of, they do polls and things like that, and then come up with a dollar value and assign it to it. So the average age of a caregiver is 49 years of age, and 48% of caregivers are between 18 years of age and 49. If we look at this slide, basically what this is saying is from the bottom part of it, that is representing the age group of 15 to 24 years old, and they are doing about 15 hours of care per week. And as we go up the ladder, or up the chart, we see that as the caregiver's age increases, so does the amount of hours that they spend caregiving each week. When we reach those who are 75 and older, they are doing about 35 hours of caregiving each week. So basically almost a full-time job is what they're doing. 6 in 10 unpaid caregivers are working paid jobs outside of caregiving in addition to the caregiving each in the last year. 21% of those caregivers, or 21% of those working were 65 and older, and then 68% of those were of younger people. 60% of those working suffered work-related difficulties. So they either had to reduce the number of hours that they were working, they had to, their job performance was suffering, so they might have been, not being as productive at work, or they might have had their boss talk to them. There was definitely effects on their job from the caregiving that they were noticing. Oops, sorry. This part down here, what it is that we need to acknowledge on that piece is that the majority of people that were working more than 40 hours a week. So they were working a 40-hour job in addition to doing caregiving. The other thing that is important in this is that no matter how many hours, whether it's 0 to 20 hours in a week or it was 20 plus hours, the majority of all of those people providing care were still working 40 plus hours in a week. It is, so literally we have people doing 2 jobs while they're doing this caregiving. One thing about statistics that I always like to, that I point out that I probably wouldn't have done several years back is there are very few studies that are done in the younger populations that are providing caregiving. So those who are 18 and younger are providing cares there, whether it is feeding somebody, it might be providing somebody companionship, taking somebody to a doctor's appointment. They are providing cares. Those do not get studied. There is about 15 studies out total studying youth and caregiving, and we know that that exists a lot more than it's studied. And it is something that we don't acknowledge in this community, but it exists. And so keep that in mind when you are thinking, how do, it's not just you that you need to support, it's also the younger folks if they're providing care. And just kind of keep that in mind as we're kind of going through things. Oops. So caregiver fatigue and burnout. It is this is when you are just basically find it challenging to do your normal everyday activities. You're also, yep. Yep. Is that better? Okay. Sorry about that. Okay. So caregiver fatigue and burnout is when you find it challenging to do your normal day activities, and when you are stressed or when you're stressed physically, psychologically, and emotionally. It can be also financially, socially. It's when you feel completely overwhelmed and exhausted by your situation, in much of the time. So if I'm looking at that, okay, one more slide, sorry. Signs of fatigue, caregiver fatigue. A lot of fatigue and burnout is going to affect your physical health. So we're looking at a lot of difficulty sleeping, feeling fatigued and tired. You might have a change in appetite. You have a lot difficulties concentrating. No, well, let me put this on the other side. That might help. You're going to have difficulties. Well, maybe not. We'll stick it back over. Okay, difficulties concentrating. You're going to have a loss in interest in doing activities and hobbies. You're going to have more difficulties at work. You're going to have a decrease in work activity, which we had mentioned earlier. You're going to have social withdrawal, not wanting to go out and do things with your friends and family. You might cry more easily. You're more irritated or have an increase in agitation. You're kind of blaming yourself. You're having feelings of guilt and worthlessness, feelings of loss of control, and the big one would be feeling thoughts of death and suicide. Now, some of these are pretty huge. Thoughts of death and suicide, we don't want to get to ever that point. And so this is why we want to concentrate on giving you guys the tools and the resources so we can prevent some of this from happening. Can I just get a show of hands based on this definition if you guys have ever felt that you've been in caregiver fatigue or burnout along the way, whether it's now or in the past? Okay. So this is, it's not uncommon for this to happen. And it's one of those things that we want to, like I said, we want to make sure that it's not happening. If we can prevent it, that's what we want to do by giving this presentation. In addition to, caregiver, just the caregiver piece of it, we're also having more stressors in our life. We're having an increase in responsibility, not just because we're doing, we're having, caregiving on top of our normal day activities. We might have a change in roles in the family. So somebody might have taken the kids to, go help them buy a car, and suddenly that person's not able to do it. And guess what? It's now your responsibility to go do. It can be small things like that, increased responsibilities. Your husband was doing the finances and now it's suddenly your turn and you're trying to figure out what was going on with the finances or how to, manage those. Financial burden. I mean, caregiving is expensive. If you're hiring in, if you're paying out of pocket for cares to come into the home, obviously you're going to have more expenses going out, which means less money to pay bills and do things at home. It can also be if you're reducing your work hours because you cannot, the caregiving is affecting your ability to work. So that's less money coming in. There's medical expenses, that might be coming out of pocket with medications, things like that. So financial burdens are huge with chronic illnesses. Changes in tradition and lifestyle. If holidays are coming, we all, many people like to host holidays at their house. And sometimes when we have somebody who needs cares, it gets more challenging to have those holidays at our house, just because it means you have to clean the house, you have to coordinate the meal, you have to, all these different things that you need to have in place. And that gets more challenging. And sometimes to give up that holiday celebration at your house, even though sometimes it might not seem like a huge deal, for many people it is. And that, just small things like that, or sometimes they're big for people, are big changes that we want, that are going to be, that are stressors for people that they just don't want to give up. Mismatched expectations. That is A classic example of this might be when somebody has, when we retire, we think about traveling with our loved one. We think about doing these things that we never had time to do. And suddenly, that's maybe not what you're doing. You're all of a sudden caring for that loved one. And what your expectation was in those quote unquote golden years is not what the reality is. And that's a hard thing. And that's something that people have to cope with. It's something that people have to literally adjust to because it's not what they were expecting. So that's another added stressor. And these are just a few examples of these things, but they add up and adding to the caregiver stress. When they do studies of caregiving, a lot of these things might seem like common sense. So bear with me as I go over this because they very much are common sense. Caregiver stress is often associated with the level of care the patient needs, the medical issues present, the perceptions of one's ability to control the disease, knowledge of the disease, finances, and how much support the caregiver feels that they have. And so when we look at that, I think one is looking at what knowledge do we have of a disease? Do we need to be asking questions when we're in with medical providers? That can decrease our stress. We can't necessarily control diseases, but we can help sometimes symptom control, which is when Nancy Nidman and all the other providers get the phone calls so that we can, once again, hopefully reduce some of that worry. Getting social workers involved to, see what's available. And then the next one is research has shown that middle-aged caregivers experience more psychological stress, social isolation, and lack of time for oneself, family, and career than older adults or older caregivers. And again, that goes back to them having to multitask. Most of them are working. And so older caregivers find the experience more rewarding. This has been related to a decrease in multiple role demands, less time restraints, and the expectation of providing care. And then several studies have shown that caregivers have less strain, better physical health, or have less strain and better physical health when they have good relationships with their loved ones. The better one's relationship is also motivates them to care for the person longer. So, as I said earlier, this is something that is normal. This can happen to everybody. This is, you are not alone if you are experiencing caregiver fatigue. This is, it happens more frequently than most people think it probably happens. We may not always recognize the symptoms in ourselves. Because we are so busy trying to do everything that it is we are trying to do, that the self-recognition is not there. This is when we have to rely on family members. If your family member or a friend is pointing out that you're just not seeming yourself, or that you're seeming more down, or that you're seeming to get more, fatigued or frustrated or whatnot, listen to your family and friends. They're not pointing this out to be mean or cruel. They're pointing it out because they care about you and they are worried that you're going to have some of these physical health issues or mental health issues. And so just kind of listen to what they have to say. Don't count it out when they say something to you, but listen to them and just self-reflect. One of the things that is we really need to take care of ourselves. Nobody takes care of us. If we're caregiving, nobody's going to take care of us. That is a hard thing to accept, that we need to figure out a way to take care of us. You need to spend the time and take the time to do that. And we don't give ourselves permission to do that. And sometimes it takes a professional, whether it's a social worker or your nurse or your provider, to say, hey, it's okay to do this, because it is. You need to do it. And if we don't do it and something does happen to us, whether that's emotionally, psychologically, and we are no longer able to take care of that loved one, what happens? Do we go into crisis mode where then we're suddenly trying to find somebody to take care of them? And if you can't they might have to take care of you. So we don't want to end up in that situation. And so the more that we can take care of ourselves initially is going to help us in the end. So how do we take care of ourselves? And that's kind of what the next part of the talk is going to be, is kind of going over these various topics so that we can kind of see how to do that. And it's giving you the tools to do that. So the first one is organization. And with organization, it's getting things organized. And it's not necessarily what makes sense to me. It's not what makes sense to you or you. It's what makes sense to you individually. So what I think is organization is going to be completely different from the person sitting next to me. It's literally what fits your style. Because I can have people with, a dining room table full of piles of papers. And if I ask them where a piece of paper is, they can a lot of times go to that exact pile that they know it's in and grab out that piece of paper. To them, that's organization. For others of us, it's having that filing cabinet labeled and everything in their place in the filing cabinet. So, like I said, it's not what makes sense to me and what my definition of organization is. It's what makes sense to you. And having that organization is going to be able to hopefully reduce some of that stress so that you're not feeling so overwhelmed. Creating a binder. The binder can be one of two different things, or combination of it all. One, it might be, kind of information about your loved one's medical issues, so their medications, their doctors, especially if you're traveling, that way you have something if you need to head to the emergency room, phone numbers and all of that. The other piece is if something happens to you specifically, does somebody know the routines of your loved one, especially if your loved one does not have the cognitive abilities to tell them? So it's going through a day-to-day thing. It's, kind of starting out, this is our morning routine. This is what we do when we get up and shower, and this is how we do the routine. Then this is what we do through the morning, lunch, afternoon and evening. And that way, if it's a family member or a friend that needs to step in that emergency, when you're having your own emergency, they can grab that binder and it's there. And you don't have to worry about, how am I going to do that? Who's going to take care of them? How do they know the routines? How do they know these things? It's very tedious to do initially, and I will admit to that, but it's going to be helpful in the end, especially, if, like I said, if your loved one doesn't have the ability to kind of make that to do that. So the critical information for caring for a Parkinson's patient handout. It's one of those things that might be helpful to put in a binder. It goes over kind of the Parkinson's disease symptoms that they are displaying, You can put medications in there, and then medical providers in the back side of it. And it just kind of gives an overview of what Parkinson's is. And again, the information in the binder, one-stop shop, all of it's there.
Where is that information available?
Did we not do handouts on that one? So we will get those out. So Steve, so they're in the back at the where you've got the other handouts. So, so when we look at remembering to take care of your own physical health, this is a hard one again. As I was saying earlier, to take the time to say, hey, I'm not feeling well. I'm having a lot of headaches lately. I'm feeling really nauseous, or I'm having other issues. To actually go into the doctor's appointment, especially if your loved one can't be left alone for periods of time. Because it's easy to say, hey, I can't do it. I just don't, either one, I don't have the time, or it's just too difficult to get to a doctor's appointment. Again, if we don't address your needs and we have that emergency with your own physical health, we don't have you to help take care of your loved one. So addressing those with your doctor is a good thing. Try to get enough sleep. That is challenging. We know that as providers. We know that you're not getting enough sleep at times, as you might be getting up in the middle of the night with your loved one. You know, if that's the case, talk to your loved one's providers. See if there's anything they can do to help with the sleep piece. Lack of sleep can affect your cognition. It can affect your physical health, your energy level throughout the day. So there are so many things that lack of sleep can affect that it's important to get as much sleep as you can. Eat healthy foods and drink plenty of water. I'm not a doctor, but if we don't put the good foods into the system, we're not going to have the energy. We're going to get that sugar rush of the junk food. Sugar rush ends, and then we're left with no energy to help our patients or your loved ones with. So eating healthy is going to give you a little bit more energy. Exercise and do stretches daily. Now, again, energy, or how much time do we have in a day to exercise? And we're not talking huge amounts of exercise. You know, it can be just stretches. It can be, you know, just doing something to kind of, you know, walking around the block, just to get the body moving, to keep you healthy. Taking the time for yourself. And this means, you know, and it doesn't mean that you have to actually leave your loved one, you know, at home. It can be, you know, it can be anything from, you know, just doing some breathing exercises to yoga to, you know, getting a massage, going out to dinner with a friend, going to a movie. It can be a wide variety of things. It's whatever, again, makes you relax. Some people find cooking and cleaning as relaxing. You know, whatever it is that you find relaxing is what I want you to be doing. For me, it's kind of usually, I think, painting and spending time with my dog. And so that is what, you know, one of those things. So, which brings me to my next slide, pet therapy. So pet therapy, it started in the 9th century in people's homes. And it first occurred in institutions in 1790s in New York. And studies have actually shown that it diminishes emotional and physical pain. It has a reduction of medical services and medications, reduces anxiety, reduces boredom, and literally makes people happy. All of that can happen with petting an animal for 10-15 minutes. 10-15 minutes. The best 10-15 minutes you're going to have in your day. Dog, cat, rabbit, horse, I don't care what animal it is, borrow a cat and go to your neighbors. But that can happen in 10-15 minutes. So this was one of my dogs, and go ahead.
Can we get a letter somehow to emotional support animals?
I believe that they can. I don't know if there's any training that, I don't know if they have any training that they can go through. There are different standards, and I don't have this with me right now. There are different standards that they have, like with the pet therapy dog versus a animal assist dog. So yeah. And I think, and like I said, I don't remember if there are standards for the emotional assist ones. Yeah. I don't remember that offhand, but it's worth trying. Yeah. Exactly. 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 And so it's worth asking about. And if the medical provider is willing to do it, I would say, have them do it. You'll need to check with the airline standards as to what they are willing to accept and not accept. So this is one of my old dogs, and I do this because it brings up the idea of laughter. And as you see, he's dressed in his Halloween costume of a devil, because he was a little bit devilish at this point. And so his horns are a little bit crocked, and the cape is off center. And you know why that is because when he went to go jump up onto the photography stand, he almost took the entire stand with him. And as I was like horrified and laughing at the same time, I think everyone in the whole entire place eventually started laughing because he was just all over the place and wild, and this is what happened. So I know that that's what my memory is of that. So, yes. So there's not ones that are specifically trained for. So the question is are there dogs that are specifically trained to help Parkinson's patients? And they are not dogs that are specifically trained to help Parkinson's patients. They are more helper dogs in general. So it might be that they might be able to, so they can be trained in a variety of ways, from picking up things off the floor to opening doors, turning on and off light switches. It can be, let's see, they have different things that they could train them on. It might be that sometimes if you fall, that you can brace on a dog, because they're larger dogs typically. So you're bracing on a dog to kind of help with getting up, kind of thing, things like that. Okay, so spending quality time together. It is extremely easy to fall into the role of a caregiver and forget what it was that you were with, what that person is to you initially. So whether that was your spouse, your child, your parent, it is so easy to say, I am now, I'm a caregiver, and to forget that they're your spouse. And we want you to take that relationship back. Whether it's even for, short periods of time, we need to take that back. It can be sitting next to them and holding their hand. It can be blowing bubbles like the picture has. It can be, reminiscing over old photo albums. It can be going out on a date night. But we need to take that relationship back so that you have that quality time. It doesn't need, like I said, to be for long periods of time. It just, the to-do lists can wait. Most of the things on the to-do list, you know what? If we get to them today, we get to them tomorrow, or we get to them next week. Most of them are not that urgent. We all know that. Sometimes letting things go on the to-do list is not always great. It's not always easy for some of us, but we need to let those sometimes go. we prioritize, making sure people, your loved one has their medications. We want to make sure of that. But cleaning the kitchen floors, that can wait. It's not an urgent thing. Because when our loved one is no longer with us, we're not going to remember the to-do list. The to-do lists are not going to be what we remember. It's that quality time that we spend with our loved one. And that's what we need to look at and make sure we're getting. Emotional support. So emotional support is critical when you are a caregiver, to make sure that you have support networks. So we have this group here tonight, which is an awesome group, and but we also, there are support groups for caregivers. They are sometimes specific ones, Parkinsons, dementia, but then there are also general caregiver ones. And the general caregiver support groups, it might be a wide variety of caregivers caring for people with different conditions, but there's a common theme, and you're going to notice that once you go. Individual counseling. Those two, the support groups and the individual counseling, I usually tell people to try those at least 3 times before you give up. Because each time you go to a support group, it might not be the same people. They might have guest speakers and then discussions afterwards. And it might just be that you take a few time, whether even with individual counseling, it's going to take some time to establish a relationship with that individual counselor. So it's not something that's going to form in. You don't just go and spill your guts out. And sometimes you do at the first meeting, but sometimes it takes those extra, sometimes it takes a little bit of time before you get used to it and comfortable doing it. So connect with somebody in your spiritual faith, so in your religion. There are online support groups and blogs. Those are becoming a lot more common. They are out there, and if you type in caregiver blog or caregiver support group online, you're going to create a huge number of them. Connecting with another caregiver. You can, whether it's here that you connect with somebody and then you go off and you talk to them. Sometimes different organizations have peer mentor-to-mentor programs for caregivers. It just kind of depends on the organizations. But that peer-to-peer support can also be important. Or keeping a journal. You don't even have to tell your feelings to anybody. You can just write them down. Nobody ever sees the journal. You close the book and you put it away. But it's getting those feelings out so that they're not building up in you. There is a 6-week program that basically called Powerful Tools for Caregiving. And this is the book, if anyone is interested in looking at it later on. It helps caregivers basically kind of figure out how to deal with emotions and self-care. And they do, each week they cover a different topic, and it's a good, and you get the book to go with. So as a kind of thing. This is offered through usually the County Area Agency on Aging facilities, senior coalitions, Alzheimer's organizations, and they just have different schedules because of it being a 6-week class that you can't join in the middle of it. Sorry.
Is there a local phone number that we can call?
I've got those down the road.
Oh, you do?
Yeah. No, you're good. They're in the slides later on. So I've got a lot of phone numbers later in the slides, so bear with me. I will get to those a little bit later. They should be coming up shortly. So I try to make it so you have kind of everything that you need before you leave as far as websites and phone numbers in the slides, so that you have kind of a place to go to later on. Building a support system of family, friends, neighbors. Can be the church that you belong to, organizations. but it's kind of building who might be able to assist you as you are needing more help. This can be people bringing you meals. It can be somebody sitting with your loved one while you go out and run errands or go to a support group. It can be somebody that might be willing to do snow shoveling, like a neighbor or something like that. So it's just kind of figuring out who might be able to kind of assist you. One of the big things is don't be afraid to ask for help and don't be afraid to accept the help. A lot of us will say, many people don't want to let strangers into their home. So if we're using a support system that we've already got through people we know, it's not as intrusive as a stranger coming into the home through like an agency. It's hard to ask for help. We always think we can do it better than anybody else. And to let go of that control is a really hard thing to do. Because nobody's going to do it like me. Or it might be that your loved one saying, well, nobody's going to do it like you. And it's, and accepting the help when somebody says, hey, what do you need? Let me help you. So there's two things in this. Don't be afraid to ask for the help and don't be afraid to accept the help. Both are hard, equally as hard, but we need to do both. Otherwise, we're going to do that burnout fatigue thing. Share the Care is a care model that uses your existing support system. It was initially developed for oncology patients or cancer patients, and it has been getting used more in chronically ill patients. A lot of different organizations have their own model of this nowadays. I don't think Parkinsons does yet. But basically, you, the primary caregiver, are not the captain of doing this. It is one of your support system people who says, yes, I am willing to do this for you, and then they organize it for you. So they might have 3 people who might be willing to bring meals. They might have 3 more people who are willing to come in and do companionship. So they know who it is that they can tap into. So when you say, we've got so many medical appointments, I'm not going to be able to make meals that day. They can call one of those people, 3 people on your list and say, hey, can one of you bring bring them a meal on this night or on 2 nights and see what and then they kind of do that. They have pages or internet pages that they can hook people up on to kind of help coordinate these things, emails. They can do a lot of these things electronically nowadays. So it's, they just send messages out and then the call to action, for the call of action. So that Share the Care is a book. They also have a website, but it's a great kind of model for doing that. So health insurance, what does that cover to help you out in the home? So that's going to cover home health services, occupational and physical therapy, which can be helpful in teaching you how to transfer a patient, how different gadgets that might be helpful to make life easier, and like different ways of bathing, kind of helping with bathing and things like that. And then hospice care. What insurance typically does not cover, though, is they do not cover what we call custodial cares. So the assistance with the bathing, the dressing, the toileting, all of these day-to-day activities is what insurance typically does not cover unless you've got Medicaid. Custodial cares. So there's 2 different things. There's the acute cares and there's custodial cares. So acute cares is going to be your physical therapy, your occupational therapy, your nursing. And then custodial cares are those day-to-day activities that we do in the home, the bathing, dressing, and things like that. And that's what insurance does not cover. So So when we looking at trying to look at physical assistance in the home, where do we go? What programs are out there that might be able to help you? And some of this might, depending upon income and assets, depends on if there might be some county programs that might be able to help you guys out. So the key is going to be with looking at some of this is getting connected with a social worker. A social worker is going to be really the key in getting things started. Let's see. Let me get it. One of the places that you can always contact is your loved one's provider's offices, their physician's offices, and see if there's a social worker connected with them. Not every single provider's office has a social worker, but many of them are having them now. And so contact them and say, hey, what can you tell me about these things? And they can walk you through what might be available. If you're receiving home health services, so if PT, OT, nursing are coming into the home, ask if there's a social worker. They can come out to the home and meet with you in the home as part of the insurance, and the insurance will come and pay for it and all of that great stuff. If you or your loved one are 60 years and older, contact the Senior Coalition or your Aging Services office. They can have people come out to the home, meet with you in your home, and connect and see what might be eligible for. Aging and Disability Resource Centers cover people of young and old. So no matter what, and they are a lot of times the starting point for services. So I've got their contact information coming up, so bear with me on that. One of the programs that's available is the National Family Caregiver Funds. And there is an age requirement of this one. It is 60 and above. They do make an exception sometimes if you are not 60 and above, if your caregiver is 60 and older, they will make an exception on that. Or if you have a dementia diagnosis. One does need to have either a cognitive disability or cognitive issue, or needs assistance with 2 activities of daily living. So bathing, dressing, toileting, meal, all of those kinds of things that I had talked about earlier. This can help with, basically it's meant to make the caregiver's life easier. So it can help with sometimes transportation. It can help with help in the home. It can help with adult day centers. This pot of money tends to be a smaller amount, but I always say every single dollar amount helps. There is no income and asset restrictions on this program, and where you would, and the amounts vary per county because each county runs the program slightly differently. And where do we access that? We're going to go back to the Aging and Disability Resource Center, and again, our contact information for them will be coming up. So there is another pot of money through the Alzheimer's Family and Caregiver Support Program. And this is a program for people with any form of dementia. So it's not just Alzheimer's, it can be Lewy bodies as well. And so just kind of keep that in mind. Age does not matter on this program. You can be 40 or you can be 80 and they will still look at funding. The big thing is that they're going to have an income restriction for this one, and that it's $48,000 net. So after everything is taken out, they're looking at what money is left for the $48,000. And that's joint income for a couple per year. And the amount that they can give out is up to $4,000. And that amount's going to vary per county. Each county, again, runs this program ever so slightly differently. And so just because I'm putting up $4,000 here doesn't mean that you're going to be able to access $4,000. It depends upon how the county runs it and is how much you're going to be able to access. Again, it's there to make your lives easier, there to provide in-home help, transportation, adult day centers, things like that. Again, accessing it through the Aging and Disability Resource Center is where you would start off with. The Parkinson's respite funding is respite care funds that you might be able to tap into. You need to have a diagnosis. Ooh, go ahead. Driving? I don't think so. I think it's more, I don't think that would be one, just because they're looking at, unfortunately, kind of bathing, dressing, more hands-on cares, but I don't believe they consider driving as one of those. Okay. Have a Parkinson's disease diagnosis, be a resident of Dane County, and member of the American Parkinson's Disease Association Wisconsin chapter. Independent Living does these funds, so that would be their contact information is there, and you can contact Jenny or Marcy in regards to those. Medicaid personal care funds, or Medicaid personal cares, that is, so with anything that's Medicaid, one has to financially qualify. And so they're looking at income assets kind of thing. If you qualify for Medicaid, they can help pay for personal care, so help with the bathing, the dressing. The general rule of this program is 67% of the cares that that caregiver is providing has to be hands-on cares. And then 33% can be more household chore kind of things. There are no age restrictions. It's really just the Medicaid eligibility for it. The state does need to approve, so whatever agency you're using to provide those Medicaid personal cares, whatever agency you're using will have to submit a plan to the state stating what cares you're wanting, and then the state ultimately is the one who approves those hours. The Medicaid waiver programs. This is state and federal funds that are used to help keep people with elderly and disabled people in their homes. And provides the financial assistance to do that. So it can be that they might help pay for a Lifeline button. It can help pay for adult daycare. It can help pay for sometimes grocery delivery service. It can help pay for a wide variety of things. With this program, you're usually connected with a social worker, a nurse, sometimes a service coordinator, depends on the program. So each county has a couple different programs. You might have heard of IRIS, Family Care, Care Wisconsin, Community Options Program, Continuous. Depending on what county you are from, it depends on what programs are offered. In addition to meeting the financial criteria for Medicaid, you also have to functionally qualify. And what they're looking at is, do you meet the nursing home level of care? And they're looking at how many activities of daily living do you need assistance with when they do that assessment. If you have questions about it or you want to get assessed for it, you're going to want to contact your Aging and Disability Resource Center, and they can come out and do that. Even if you're questioning if this is a possibility, just have them come out and do this, and talk with you and see what they think. It doesn't hurt to meet with them. The area agencies on aging and senior coalitions. They assist depending upon, I think, depends on the county, what age level or age they're looking at, 60, 65, somewhere in there and above. And they basically are, again, connecting seniors or people with resources to help them stay in their homes. This can be anything from Meals on Wheels to nutrition sites to food pantries to telephone reassurance calls, home chore services. It's just a wide variety of things that might be there. So, how do you contact a senior coalition? Here are phone numbers to do that. So depending upon where you live, depends on what one it might be. And if you contact the wrong one, they'll give you the phone number let you know which one it is. So 2 pages of different phone numbers for all of Dane County. This slide, so I've got phone numbers for the Aging and Disability Resource Centers in Dane County and all of the counties surrounding Dane later in the slides. I know people like links, and so website links. And so the first one is for the Aging and Disability Resource Centers. They, when you go onto their website, they'll have a state, or you can either click on your county by name, or you can do it through the map. County and tribal aging offices. So if Native Americans, there's separate offices for that. And then independent living centers, which I will touch on briefly, but they kind of were the precursor to the Aging and Disability Resource Center, but they are still around, still full of great resources. But there's one particular link or one particular program that they do specifically. So, so this is the slide with the Aging and Disability Resource Centers, all of Dane County and surrounding. So and like I said, if your county is not in there, there is the link, the website that you can get that would show that. If you're from Illinois, which I don't know how many we hit from Illinois to these things, but I thought I'd throw it in there. Independent living centers down in Illinois do the same thing as our Aging and Disability Resource Centers here in Wisconsin. So that is some of the counties down in Illinois. Another place that you can call for help is the United Way. And United Way First Call for Help, they share the same databases as the Aging and Disability Resource Center. So they have access to, whether it's nutrition sites, they have access to support groups. So if you're questioning, where do I go for a support group? And if you're looking for something specific, they can look in their database, huge database, much bigger than what UW has or anybody else. And it's literally calling 211. So it's kind of like dialing 911 or 411, but don't dial 911 to get assistance with your resources. Dial 211, and if you call them, they will pick up the phone and they will connect you with information and referral person. They also, to plug this as well, if people are looking for volunteer opportunities to kind of get a person more active or seeing things like that, they have a huge amount of volunteer opportunities because they support many of the nonprofits in Dane County and surrounding areas. The WIS Loan Assistive Technology Program. This is a program that provides helps to pay for assistive technology and home modifications for people with disabilities. Now, this is, it can help pay for wheelchair ramps, bathroom, kitchen models, computers with modifications to help somebody with disabilities, magnifiers, things like that. One thing I want to make clear is this is not a grant where the money is just given to you. This is a low interest loan. This is something that has to get repaid. So they are literally borrowing you the funds to do the modification or get the equipment, and then you need to pay it back. So it's most of the other ones that I have been talking about where there are funds available, you don't always have to pay. So This is the one that has, that is through the independent living centers, which, but if you call the Aging and Disability Resource Centers, they will connect you with they'll connect you with the phone number for the independent living centers. Another resource is going to be the Melvin Weinstein Parkinson Foundation. They assist people. They have some funds that can help pay for medical equipment, other supplies, and some home modifications to make sure that the person has got a safe environment. And it's specifically for people with Parkinson's disease. Their contact information is there: email, phone, and website. And many of you are familiar with the American Parkinson's Disease Association. They help support people through education, support groups, exercise groups, mentor programs, and funding research. And their contact information is in there. Huntington's Disease Association. I'm throwing in a couple of different things here. Huntington's Disease Association helps families with and patients with Huntington's disease through education and funding research. Their contact information is there. They do have a support group the second Saturday of every month at Attic Angels, and the person who runs that support group, her contact information is there. The Alzheimer's Association and the Alzheimer's Dementia Alliance, they again support all forms of dementia, including the Lewy bodies. And they have social workers that can meet with you in your homes or wherever it is that you would like to meet with them. And they have a large number of educational programs, support groups, and other things. The Alzheimer's Association specifically has support groups online, so that if you are wanting that one online, they do have one for both the patient and the caregiver. Their contact information is there. So, my parting words to you is, and I said this earlier, do not be afraid to ask for help. And do not be afraid to accept the help. Doesn't mean that you're not doing a good job. It doesn't mean that you are weak. It takes a strong person to know when they need the help. And so reach out to people. Be specific as to what it is that you are needing. Because when you say to somebody, I need help, that can be 20 different things that goes through the person. You know, we don't know, when we're at the receiving end of that comment, we don't know what you need the help with. And so the more specific that you can be, I need to have help Thursday afternoon so I can go to a support group. Can you come and stay with my loved one? Then they know what it is that you are requesting. But a blanket statement saying I need help, they don't know what that is. And so we need to be specific about what we're asking for. We want you to ask for help sooner rather than later. We don't want you reaching that crisis mode. We don't want you burning out. We don't want you having your own health issues because we're not taking care of ourselves. So make sure that you're asking for help early on. Keep a sense of humor. I cannot tell you how many patients come to me when they're kind of joking about something or being sarcastic about something, and they look at me and they say, oh, I'm sorry. You know, and I say, there is nothing to be sorry about. You need to keep that sense of humor alive. You need to laugh about what is happening in your life, because if you don't, you're just gonna go down. You kind of get sucked in, and We need that sense of humor. We need to laugh. That is the best medicine that anybody can do. And so do not apologize when you go into a doctor's office and you laugh about something that it might be just between the two of you that they might not understand. That's okay. That's, that's okay. You need that sense of humor. You need to be able to laugh at the situation at hand. It is what it is. We make the best of what we're doing, but keep the sense of humor alive. So that's my presentation.